I chose to do my report on the Corynebacterium diphtheria outbreak the CDC listed is going on in Nigeria, or as of February, so last month. So as we all know, Corynebacteria is a gram-positive variety of bacilli. They are known for being forming Chinese character formations or club shape. Corynebacteria diphtheria are catalase positive, urease negative, and some of them produce toxin, which is known for their virulence. Now, this toxin, the way you determine if that's present is by testing using the ELIC test, if I'm pronouncing that correctly. If the toxin is present, it is known for killing respiratory system tissues, so this typically leads to symptoms as difficulty in breathing and swallowing. The toxin can also cause heart, nerve, and kidney problems if it's able to enter the bloodstream and spread. The way that diphtheria is spread is through respiratory droplets, so when somebody coughs or sneezes, and occasionally it can be spread through open sores or ulcers. For some, respiratory diphtheria can lead to death. For those that are treated, it's usually about 1 in 10, and people who are not treated, usually about 5 in 10. The biggest way to protect yourself against diphtheria is vaccination. So if you're 2 months or older, it's recommended to get a vaccination, and then as adults, get booster shots as needed, especially if you're expecting to travel to an area such as Nigeria right now where there is a breakout of the disease. Another way to avoid getting it is avoid people who are symptomatic. So these would be individuals who have a fever, sore throat, difficulty swallowing or breathing, change in their voice, shortness of breath, or weakness or fatigue. A couple other simple basics to avoid getting diphtheria is: number 1, don't touch others' open wounds. Kind of common sense. The good old hand washing, we've heard that a million times. When you sneeze, cover your mouth and nose. And then another important thing to remember too is if you are during travel or after traveling to an area that could be suspected of having an outbreak, is if you have any kind of sickness with the symptoms mentioned before, is to seek immediate help, and if you need to isolate or remove yourself from others to reduce the spread of the diphtheria.